Assalamualaikum and salam sejahtera. I'm Norzihan Ayub and this is my team members Kamila Ading, Patricia Joseph Kimong, Nora Fifa Bali and Norma Razali. We are from University Malaysia Sabah. Today I will present my topic, the effectiveness of cognitive behavioral group counseling in reducing anger and aggression among drug addicts. Anger, an integral part of our daily life, is one of the universal emotions that exists in all individuals, even in the young ones and not just the adults. And when self-confidence and personal integrity are attacked, anger occurs as a natural response. However, when anger is severe and frequent, it becomes disturbing and causes discomfort that can damage someone's relationships. Uh, Lee in 2016 stated that the inability to control the emotions of anger can be a trigger the emergence of aggression. Aggression and violence have a negative impact on both society and personal well-being, often leading to major negative consequences for both the victims and the aggressors. Anger and aggression also are associated with substance abuse. Woodrow in 2008 stated that drug addicts who have higher anger are also heavily involved in some violent criminal activities. Shabir and friends in 2020, through their studies on the impact of drug use on aggression and delinquency among adults, showed that drug use acts as a moderator among aggression and delinquency for male adults. The results indicated that drug users have significantly high rates of aggression as compared to drugs non-users. Therefore, intervention should be developed to help overcome the problem of anger and aggression. Jankowski in 2005, who studied 78 female and male who suffered from drug addiction. The purpose of this study is to determine whether an anger management group intervention can reduce anger in a population experiencing drug dependence. The group experimental complete 10 sessions of cognitive behavioral intervention, and the results show that anger management group intervention was associated with a reduction in anger in patients suffering from drug dependence. Similarly, anger management group intervention was associated with a reduction in positive urinalysis in patients. Wadlizer and friends in 2018 had conducted an alcoholic adapted anger management for outpatient alcohol, and the results showed a greater improvement in anger and anger-related cognition among group intervention. The results showed during the improvement in threat anger were most strongly associated with reduction in drinking problems during the follow-up. Although the issues and effect of anger and aggression are much talked about and become a serious issue, in Malaysia, experimental research conducted to examine the phenomenon effect on intervention to overcome anger and aggressiveness was very lacking, especially involving drug addicts. Studies related to drug addicts are also more focused on ways to recover the spirituality and drugs addiction. Therefore, the main objective of the study is to examine the effectiveness of group counseling intervention on anger and aggression among drug addicts. For the methodology, this study was conducted by using a quasi-experimental study with a pre-test and post-test control group design. There were two instruments have been used. First, the Noveco Anger Scale Provocation Inventory is composed of two parts. Part A was Noveco Anger Scale was to measure experience of anger. These two contain 60 items. The item for the anger scales contain four subscales such as cognitive, arousal behavior, and anger regulation. Part B was provocation inventory scale, which identify the kind of situation that induce anger in particular individuals. Provocation scale consists 25 items. In this study, the internal consistency of anger is measured by Cronbach alpha. Score is 0.92, while the arousal, cognitive, behavioral, and anger regulation subscale are ranging from 0.6 to 0.84. Meanwhile, the provocation is 0.91. A second, the aggression questionnaire is a self-report measure which uses 5-point rating scales to measure aggression. And the questionnaire consists of 29 items. The aggression questionnaire consists of four subscale, such as anger aggression, physical aggression, verbal aggression, and hostility. The internal consistency of aggression questionnaire was 0.87 and the subscale were ranging from zero point 0.6 to 0.7. The participants for the experimental research study were selected among male drugs addiction from one of a rehabilitation center in Malaysia. The age varied from 21 to 43 years old. 20 participants were selected to participate in the experimental study based on the highest score of Noveco and aggression questionnaire at baseline. The participants were assigned into experimental group and control group through purposive sampling. There were 10 participants in the experimental group and 10 participants in the control group. The experimental group received a session of group counseling intervention. Group sessions were conducted in a week and each session lasted for 2 hours. And meanwhile, the control group did not receive any treatment. After the experimental group complete the group counseling session, all the group, both experimental and control group, were given the post-test by using the same tools. And for the data analysis, uh, analysis of data was carried out using SPSS and sample PET tests were used to analyze the data. And the result as shown in the table 1. Okay, the analysis sample PET test result shows that there were significant differences between pre-test and post-test on anger and anger subscales such as cognitive, arousal, and behavior in experimental group. The p-value shows less than 0.05. Meanwhile, there were no significant differences between pre-test and post-test on anger regulation subscales. The results also showed that there were significant differences in pre-test and post-test on provocation in experimental groups. Next, as shown in table 2, the result shows that there were significant differences between pre-test and post-test on aggression and four aggression subscales such as anger aggression, physical aggression, verbal aggression, and hostility in the experimental group. However, as shown in table 3, the result shows that there were no significant differences between pre-test and post-test on anger, anger subscales, and provocation in the control group. And table 4 also showed that there were no significant differences between pre-test and post-test on aggression and aggression subscales in the control group. So studies on anger, anger subscale, and provocation have shown that there were significant differences between the pre-test and post-test in the treatment group. And the mean score is decreased. This study has been supported by several studies that group intervention can control anger among drug inmates in treatment groups. Yeah, the study conducted by Briscoe 2001, Jankowski 2005, Relay 2000, and Udro 2008. Conversely, Howell and friends in 2005 study the effectiveness of anger management to offenders shows that group therapy of anger management with cognitive behavioral shows less impact to intervention group. Maybe this is due to a lacking of motivations and many problems that facing by the offenders. However, in the study, it can be seen that there is no difference between pre-test and post-test on anger regulation for the treatment groups. However, the mean is slightly higher than before the intervention. This result showed that experimental group had little effect in controlling some of the anger due to certain situation. This is contrast with Omid and friends in 2014 studied that suggests impact of cognitive behavioral approach on increased anger control and decreased cocaine use as well as more prolonged opiate withdrawal. The result of the study also showed that there were significant differences between the mean score of aggression and aggression subscale before and after the intervention in treatment group. So the mean score also showing a decrease. This suggests that cognitive behavioral intervention can reduce aggressive behavior in the treatment group. This study is also supported by study from McLaughlin 2000 and Briscoe 2001 that the group of cognitive behavioral anger management can reduce aggression and violent behavior among drug addicts prisoners. This study is also in line with study by Zarasenas and friends in 2017 that anger management education could decrease the level of aggression and develop health promotion among patients abusing substance. They found that anger management training can increase the awareness of drug patients about the concept of anger, the factors that lead to violence, and how to control it. It also promotes health and useful social behavior and can help the patient how to deal with psychological stress well without using aggression when facing other people. In this study, the result also showed that there were no significant differences between pre and post test on anger and aggression in control group. This study is in line with study by Zarazenas and friends in 2017, which control group did not receive the intervention. The level of aggression was higher. Although in this study, the control group showed no significant differences, but the mean result is slightly decreased in anger and aggression. This is probably due to the factors of others program was carried out at the rehabilitation center that may influence the results. However, the decrease in the intervention group is greater than the control group. Through this study, it can help the rehabilitation authorities understand the level of anger and aggression among drug addicts and identify the appropriate steps in prevention and recovery. Besides, the authorities can use the Manual of Cognitive Behavioral Group Counseling as an additional treatments model. It also can be adapted and practiced in all rehabilitation in Malaysia because currently there are no uh, intervention for managing anger and aggression. And there are several limitations in the study. First, there are no follow-up with the drug addiction after the end of the treatment due to time limitation. Thus, the study cannot confirm the extent to which intervention effect persists following the termination of treatment. So, future studies should have a long-term follow-up to evaluate the progress and to assess the maintenance of the emotions and behavior. And second limitation, this intervention can only be carried out for 8 sessions, and this is a short treatment actually. It may still not enough to fully help the group members in controlling emotional behavior. So it is recommended that in the future, group counseling can be extended in order to see a better and positive effect. In conclusion, the result and finding of the study can be used by others to show that one of the approach to anger management skill training, which is cognitive behavioral group counseling, is a valid tool used in reducing anger, aggression. And finally, cognitive behavioral group counseling has a significant impact and can be used effectively to reduce anger aggression, specifically in drugs addicts. Thank you.